this is the clavicle, right-sided clavicle. The anatomical positions are: the sternal end is directed medially, the acromial end is directed laterally, the medial one-third is convex and directed anteriorly, lateral one-third is concave and directed anteriorly, and the inferior surface is marked by a groove for subclavius muscle. Now, for the parts, it consists of the sternal end, the acromial end, and the intervening shaft. The intervening shaft is convex or concave anteriorly. Now, in the sternal end, it articulates with the clavicular notch of the sternum from the sternoclavicular joint. Sternoclavicular joint, and the acromial end is flattened, and it articulates with the acromion process of the acromion from the acromioclavicular joint. Now, the lateral end consists of the anterior border, posterior border, superior surface, and inferior surface. In the anterior border, there is attachment of the deltoid muscle in its whole length, and in the posterior border, there is attachment of the trapezius muscle. In the inferior surface, there is a tubercle which is known as the conoid tubercle, and a ridge which is known as the trapezoid ridge. Here, in the conoid tubercle, along with the trapezoid ridge, there is attachment of the conoid part and the trapezoid part of the coracoclavicular ligament, and the superior surface is subcutaneous. Now in the for the shaft, in the medial two-third, the medial two-third is rounded. It presents the following surfaces: this is the anterior surface, this is the superior surface, this is the posterior surface, and this is the inferior surface. Now, in the superior surface, there is attachment of the sternocleidomastoid muscle. In the anterior surface, there is attachment of the pectoralis major muscle, and in the posterior surface, there is attachment of the sternohyoid muscle. The inferior surface, में कुछ था? The inferior surface, there is a ligament which is known as the costoclavicular ligament. Now, for the lateral one-third of the shaft, presents the anterior
lateral end of the medial tooth.
Lateral end of the shaft, it presents lateral end of the medial two-third. On its inferior surface, there is a groove which provides the attachment of the subclavius muscle, and this groove has two lips, outer lip and inner lip, which for the attachment of the clavipectoral fascia. Now, there is some relation in the posterior aspect of the medial two-third of the shaft. The relations are like this: internal jugular vein, subclavian vein, beginning of brachiocephalic vein, then subclavian artery, trunk of brachial plexus, apex of the lung with pleura, and suprascapular vessels. This is all about the scapula.